Let's just briefly summarize the manifest and obvious and documented harms of so-called gender-affirming care. Reduced bone density and bone strength from puberty blockers. The state of Georgia didn't include puberty blockers in its bill restricting these procedures because the sponsor had been told that it was entirely reversible. We know that's not true. You can't reverse time. And so if a child has his puberty blocked at 13 and his peers go through puberty and he gets off of them 4 years later, that part at least is obviously not reversible, and we know there's serious physiological effects of this. It likely harms brain health. This is a topic of continuing research. Just look at all of the reports. There are very profound and underappreciated effects on mental health and cognitive development from puberty blockers alone. There's psychological distress. There's obviously infertility, at least if these are continued, and insofar as they're the beginning of a treatment pathway that leads to infertility. Stunted growth, which is at this point quite well known. Now let's turn to cross-sex hormones. A heart health risk. We don't have long-term data on this by definition because we're in the beginning of the experiment with doing this with kids. Infertility, for obvious reasons, seems to be a serious increase in cancer risk. Mental harm. So many detransitioners, especially females, will talk about an initial euphoria from testosterone, but this is sort of a honeymoon. And a year or two in, many detransitioners report actually quite harmful and distressing mental effects. The sort of regret and detransition was not supposed to happen, but cross-sex hormones has very specific physiological effects. And then almost inevitably, when we get to the surgeries, these are not one-and-done surgeries. The so-called gender-affirming care in which you create facsimiles of the other sex, that's not a one-and-done. These usually require maintenance. They very often require follow-up. They may, in some cases, involve years just trying to heal the wounds from the initial surgery. There is an iatrogenic harm just puberty blockers alone, even if they were by themselves reversible. We know that if a child is put on the transition pathway and starts taking puberty blockers, he or she is much more likely to continue down the pathway to full transition. So the question of whether puberty blockers alone are sterilizing doesn't quite answer the question. Now, any surgical or medical intervention has risks, so why would anyone be willing to bear this? It's almost certainly because of the false calculus that parents are presented with. If you're a parent, the worst scenario you can possibly imagine for your child is then you're told by a trusted physician, I have a way out for you, though. It sounds terrible in the abstract, but it will prevent the worst outcome. It's only with that emotional blackmail, I think, that most parents would ever have entertained starting this process in the first place.